welcome. Thank you guys for coming today. I'm really excited about talking about the project that I created for Hamline, my master's degree from Hamline. It is a website for post-secondary educators in using mindfulness for college students. So just to give you an outline of what I'll be talking about today, I'm going to be going over each of the areas that I have on the website. So different mindfulness programs that were in the research, what is mindfulness, implementing a mindfulness program with college students, best practices, the research, and then I'll show some resources as well. And if you have any questions at all, just feel free to ask. All right, so as most of you know, there is an interest at the college for doing some mindfulness programs with our students. At this point, we do have a few things going. It's not formalized, but we have the guided meditation in the fitness center. I did talk to the fitness director about how that's going, and this semester, which I believe it was new this semester, last semester she had yoga that had some meditation implemented in it, but she has not had a good turnout at all for that. Students aren't coming. She did say too that students are typically not coming to a lot of the group fitness classes, so it's not completely unusual. But when I start talking about the best practices, we can talk a little bit about why that might be happening, why students aren't attending drop-in sessions. We also have the meditation prayer room. It's also a mother's room. And as probably you're aware, it is locked. And that just started last year. Before that, it was open. But there was a decision made that they wanted to have that locked, and students would have to check out the key from the library. So I did check with the library to see what kind of use that is getting. And so far, this is what, the 14th week of the semester about. I just checked this yesterday. There were 9 students over the whole course of the semester so far who had used it. 9 times total. So, you know, that's less than 1 time a week that it's being used. We've also had some informational and practice meditation sessions at our welcome day. And that one was actually pretty well attended. And then last year we did the meditation session right before spring break. Some instructors have used some breathing exercises, mindfulness apps in their classes. First year experience, I know that some instructors have used that in their class, but it's not consistent. It depends on the instructor. And then of course the counseling center uses mindfulness in some of their counseling sessions, so more of a one-on-one as they see the need for it, or as students are interested in that. So again, it's not a systematic or formalized program, and there has been discussion about how could we do that, and what would that look like, and how would that best work. And so that is what led me to my research. And so my research question is, I should know this off the top of my head, but I'm going to just read it so I have it correct. How do mindfulness-based interventions impact student stress management and academic performance? When I first started looking into this, it was actually a few years ago now, there was not a lot of research in the post-secondary setting with mindfulness. There was very little. Actually, since then, there's quite a bit more, and so it is really growing, and you know, you probably know just from your own experience that it is becoming more and more common on university campuses to have meditation centers or just offer different kinds of workshops, those kinds of things. So there is a lot more research than there was, but it's still very much a growing field. So it's still very much in its kind of the beginning. So as you heard from my research question, I was specifically interested in stress management and academic performance. Some of the mindfulness research with post-secondary students has to do with like substance abuse, eating disorders, you know, across the gamut. Not a lot, but there are some of those studies that are out there as well. But for my purposes, again, I was looking specifically at stress management and academic performance.
Can I ask a clarifying
Yes.
question? How did you, and you might be getting to this, if you are, just like cut me off.
Yeah.
How did you define, or like what did you look at when you were looking at academic performance, and like how did you define, I'm assuming, success in terms of that?
Yeah. Basically, I was looking for if it made a difference in how they were doing in courses, or if it was making a difference. Because there were things like research in professors using it at the beginning of their class to improve like a writing assignment or the test at that time.
Yep.
So I didn't want to get out into all of those minute details because I needed to focus a little bit.
Sure.
So mine was more overall,
Okay.
if it was improving their academic performance in terms of their grades or retention, persistence.
Okay, perfect.
Also, just in general study skills, so like organization or focus or things that are going to help a student across the broad spectrum.
Thanks.
So, yeah. So back to where I am at here. Okay. So again, one other thing I was going to say is I have a personal interest in mindfulness because it's something that I have practiced for a while. I first learned about, kind of the Eastern philosophy and Buddhist tradition and whatnot in college, and I became very interested in that. But then I started reading more about secular versions as well as of mindfulness programs, and I'll be talking about those. That's really what's more common in college setting is the secular versions. Any other questions? Okay. So one other thing I was going to say is one reason that I wanted to look at stress is it is consistently reported as a #1 mental health factor affecting students' performance. And also, in my research, I found that mindfulness-based interventions have been shown to impact student stress and academic performance. The About page is just about me and working on my master's program, and that this is part of that. So what is mindfulness? I'm not going to show this video because it's 10 minutes long. But it's a really good video that shows the science of what happens neurologically when you're practicing mindfulness or meditation, and how it changes the connections in your brain. And so I encourage you to check that out later because it's really interesting, and they do a good job of making it interesting to watch as well. So a lot of science in that video. So as I mentioned before, mindfulness has its roots in Eastern thought and philosophy, but secular programs are becoming increasingly popular in workplace settings, in educational settings, in health settings. When I was doing my research for this, I found a very large amount of programs in the K-12 setting. More so, really, than there is available for post-secondary, which is really interesting because they are kind of ahead of, I would say, where we are in the post-secondary setting. And a lot of those programs are meant for teachers to be able to just follow along and use it in their classrooms, so they don't necessarily have to have a lot of practice themselves. But that's just kind of a side note. It's very interesting, kind of the difference between what I was finding in K-12 and the post-secondary setting. So mindfulness, there's going to be a lot of different definitions for mindfulness, but one that comes up again and again has to do, of course, with paying attention. That's one of the main things. It's about bringing yourself to the present moment, so you're not on autopilot so much, so that you're aware. So paying attention, but also with curiosity and without judgment. Not all definitions use those, but the thing about the curiosity and without judgment has to do with opening ourselves up to what is happening right now rather than being resistant. Also, if you're curious and without judgment, you're going to be less reactionary, be more aware so that you're making choice rather than just responding to something without really realizing what you're doing. So for me, I think that added part about the curiosity and without judgment is really important for that. Formal practice is setting aside time for mindfulness through meditation, whether it's sitting, walking, body scans, yoga, or whatever means you want to use to direct and focus attention and awareness. Generally, you will start a practice small and grow from there. Do you mind if I ask if any of you have your own private meditation or mindfulness
Shine
practice?
is.
I was going to say, I do.
Uh-huh.
Each morning, I take time out of my day to write down 3 things that I'm grateful for and 1 thing that I'm going to do to promote my own happiness in that day.
Mm-hmm. That's awesome. I love that. Yeah. So do you do some informal practice throughout the day as well? So informal practice is just weaving mindful awareness throughout your day. So it could be just stopping for a minute to take some deep breaths, or just noticing as you're walking into a room, you're paying attention to the actual process of walking in. Do you do that?
I wish I could say that I did it regularly. It's something that I try to do and am working very hard to make a better habit of, but I've got room for growth.
Yeah. Yeah. Oh, and I think anybody could say, even if you've been doing it a long time, I think anybody could say there's room for growth. Again, it's no judgment. And just any attempt, I think, is worth that. I do have a formal practice, but I'm not perfect. I don't do it every single day. I try, but it doesn't always happen. I do try and do the informal practice because I do find that helps a lot in times of stress or things, like this presentation, things that get you a little bit stressed out. But it's a work in progress. I mean, it's always something that I kind of have to bring myself back to and reminding myself. So we'll talk more about the benefits on the research when we get to the research page. But I just wanted to show you that. Now, mindfulness programs. When I was doing this research, there were some programs that kept on coming up over and over. Those were acceptance and commitment therapy, KORU, learning to breathe, or LTB, mindfulness-based cognitive therapy, or MBCT, mindfulness-based stress reduction, or MBSR. The acceptance and commitment therapy and the mindfulness-based cognitive therapy are more therapy based on cognitive therapy, just as it says in the title. And so that you're going to see more in counseling settings, counselors or therapists doing those. But a lot of universities will have workshops that their counselors will offer in groups so that they're getting that out there to more than one student at a time. What's interesting about KORU and Learning to Breathe is that they are both were specifically designed for college students or emerging adults. KORU was developed by 2 psychiatrists at Duke University. I actually have their book, and I've used it. I did teach a class last year, and I did use this book to do that. It's got curriculum, it's got activities, it's got even how to promote the program, how to make referrals. I mean, it's very all-encompassing. It is geared for students or adults 18 to 29. Now, as we know, a lot of our students are about the age of 29, so this would not fit every student here, but it is a really great resource for those emerging adults. Learning to Breathe is also one that, it was actually first developed for adolescents, so like teens in school settings. They now have a version just like Coro that is for emerging adults. And they've got the same, I haven't used that one as much, but they've got the same kind of resources that Coro does in terms of curriculum and whatnot. So I'm just going to click into each of these so you can kind of see what each of these are. So again, ACT is going to be used more by a therapist. It uses mindfulness, acceptance, commitment and behavior change strategies to increase awareness to inner thoughts and feelings for greater clarity in choosing behavior based on chosen values. The mindfulness that's used in this tends to be a little bit briefer. It's not the longer periods that some of the other meditation sessions that some of the other programs have and use. Coro, like I said, is designed specifically for students and college students and emerging adults. It teaches mindfulness, meditation, and stress management. L2B, originally designed for adolescents, now a version for college students. BREATHE acronym stands for Body, Reflections, Emotions, Attention, Tenderness, Habits, and Empowerment, and they've got a curriculum that addresses each of those. MBCT again is going to be cognitive therapy, and so it is something that a therapist or a counselor would use. It's based on MBSR, in that they saw, and I'll talk about MBSR in a second, but they saw the evidence that was coming out on that program, and so it's developed in the sense that it's the same format as 8 weeks long, a day-long intensive, and mindfulness is the basis for it. But it's specifically for people with recurring depression or chronic unhappiness, and helpful for to change your patterns of negative thinking. And then MBSR, or mindfulness-based stress reduction, is it was first developed for those dealing with chronic illness and pain and stress that comes from that. It was developed by John Kabat-Zinn, Dr. John Kabat-Zinn, who was at the University of Massachusetts Medical School, and a lot of people have read his books. They're very popular with just the general population. I read this, I love it. Wherever you go, there you are. So he's really reached beyond, I mean, with his program that he developed, it has reached a lot of people, but through his books, he has just reached a broad audience about mindfulness. I see that I need to hurry up because I think I've already been talking for like 15 minutes. Okay, so implementation. So 3 things to consider when implementing a program at a college is the needs of your student, available resources, and the experience of facilitators, educators. You know, obviously, needs of students are going to be a little bit different depending on, you know, are they working, do they have a family, all of that. But there are some kind of commonalities, and that is the time. They don't have a lot of time. That's why some of these programs have shortened. They're shortened so that they're not taking up as much time, and that students can fit it into their day a little bit more. Some of them worked out to 20 or 30 minutes a day at the most, whereas if you do the full mindfulness-based stress reduction, you're working up to like 45 minutes a day or more, and you know, students just probably are not going to do that. And so, so again, a lot of the programs were modified for that reason. Stress, of course, like we said, is #1 health factor in academic performance, mental health factor. Persistence. So if anybody has tried to do a mindfulness program or meditation, it is not always easy to stick to it. You may really have great intentions. You may really know, you've heard the benefits, you know it's good for you, but it's not always easy to do. And so we'll see later in the research that providing guided practice and practice outside of the training are key elements to getting students to learn how to actually do it and then do it on their own. And then I did look a little bit at specific populations because I was specifically interested in first year students and also at-risk students, but there's really not a lot in the research at this point for those populations. Available resources. I'm not going to go through every single thing to consider here, but this is some of what the research showed how you could offer a mindfulness program, again, depending on what you have available to you. So it could be standalone credit courses. Some universities offer that. Non-credit workshops, and I think that is something more likely what we could offer at this college. Embedding mindfulness in existing courses, of course some instructors are doing that. Peer-run programming, this has been especially helpful in universities that have residence halls. So with our students being here for 2 years and there's such a turnover, they're not here a long time, that might not be as easy for us. There's a lot of online training available, but that is one area that the research shows that students are not as likely to complete. Just like any online program it can be, or any online class. Students don't always complete that. And then if there are meditation, contemplative, or wellness centers, I think with our fitness center that is a perfect place for us to be able to offer something. Any questions about that? I kind of went through that quickly. Because I took too long before. No. So one thing that was very interesting about the research that I was looking at, it didn't necessarily say that it was mandatory, but the studies all had people that were doing it that had their own years of mindfulness experience. Now, like I was saying before, that K-12, those programs that I was seeing there, some of them, it would be a very short training that a teacher would go through before they started offering that. So it's just kind of interesting, the difference. But for somebody who does want to do this, and if they don't have their own experience already, there are online live courses. There's also teacher certification that educators can go through. Some of these you would need to be a counselor, but not all of them. So some of the best practices from the research, as I kind of mentioned before, students benefit from guided practice. So it's not enough just for them to know that it's a good thing. They have to have that guided practice. As I just mentioned, educators, facilitators should have their own experience with mindfulness practice. You should offer situations where students can build their confidence and repeated practice. So most of the programs, they're offered over a period of weeks. They may not be the full 8 weeks, like some of the secular programs, again, thinking about the time constraints, but 3 or 4 weeks long. That's Coro is a 4-week-long program, for example. When offering workshops, give outside of class assignments to promote the mindfulness in other settings. Some mindfulness-based interventions may be better for certain students. So, as I mentioned before, MBCT is good for recurring depression and chronic unhappiness, and so on. And then, like I just mentioned, offering classes over a period of weeks, however, modifying it to consider the time constraints of college students. That day-long retreat that's in MBCT and MBSR, mindfulness-based cognitive therapy and mindfulness-based stress reduction, those are generally taken out when they're offered to college students, at least in the research that I saw, just because students aren't necessarily going to have that time to be able to do that. And then just simply giving that information is not enough. And so sometimes I know we do that here. We'll talk about, mindfulness apps that are available, or and there's nothing wrong with that. But for a student to really make a practice of it, they do need to have that guided practice. Any questions? So, as I mentioned before, I was specifically looking at how mindfulness programs in college students, as it relates to stress, academic performance, and then I was also interested to see about first year and at-risk students.
What was your definition of an at-risk student?
First generation, low socioeconomic status, background, student of color, and academically underprepared.
Okay.
So obviously not every student that is one of those is an at-risk student, and
Sure.
I completely understand that, but I just wanted to see if there's any research out there specifically for that. And I mentioned this, I mentioned this in my paper that I wrote too, that I was first generation, and I came from a low socioeconomic background. And I should probably talk about this when I get to that point maybe, but I didn't really feel like I did belong when I first got to college, and so just looking at different supports and different things that can make a change for students in that. So a lot of the research did show that it was definitely helpful with students managing their stress, reducing perceived stress. So just to kind of look through this, there was reducing emotional distress, stress, anxiety, depression, quality of sleep, mindfulness and self-compassion, reduce stress and enhance forgiveness. This one was interesting. It was a comparison between using mindfulness-based stress reduction and interpersonal process group intervention, which is a common therapy that is used in college counseling centers, and then a control group. So both the mindfulness and the IP groups did show significant reduction in anxiety, depression, and interpersonal problems. But at 6-month follow-up, only the mindfulness group maintained reduction of anxiety, depression, and academic problems, whereas the IP group maintained reduction in interpersonal problems. So again, it kind of can give us some guidance on where we would want to use this. Comparing MBCT and ACT found a significant decrease in psychological concerns and increase in mindfulness and acceptance for both groups, with a trend for greater reduction of anxiety with the mindfulness-based cognitive therapy. And then in a meta-analysis of 24 studies, mindfulness interventions along with cognitive and behavioral were found to be effective at reducing stress and anxiety. So just kind of more studies here. It helps students with stress reduction, focus, problem solving, and relationship building. And incorporating formal meditation and informal practice may show more promise for students than just brief mindfulness activities. Any questions about that? So that was as it relates to stress. With academic performance, not as much that was specific to this, and sometimes it was actually, a research, a study was looking at something like stress, but then they also looked at the academic performance as well. But in a review of the literature, it was found that, Leland found that mindfulness training can help students be more successful and more connected to their college community. Because mindfulness teaches students to be attentive and calmer in the present, it can help improve study habits, planning, and organization. In a study conducted to examine the effect of mindfulness training in wandering attention, the results showed a reduction of mind wandering. And mindfulness training can help improve academic performance by helping students gain organizational and planning skills, perform better on exams, and use critical thinking skills. Any questions about that?
A question.
Yeah.
In your research, did you ever come across a study focusing on students that had a diagnosis of ADHD or ADD and whether or not mindfulness was helpful to them specifically?
There are studies on that. I didn't, because again, I wanted to keep it more, I didn't really incorporate that study in my research, but yes, there are studies specifically on that and showing that it can benefit those students.
Thank you, I'll look
Yeah.
into that.
Yeah. Mm-hmm. So we've talked a little bit at this college about, do we want to add mindfulness to our first year experience course? And so I was interested in that and what the research shows for first year students. I'm not going to read through all this, but in several studies it did show for first year students, it showed a reduction in stress and better coping mechanisms. And also the experimental group showed better academic achievement. Actually, I'm going to talk about this because this was kind of interesting. At a 4-year follow-up, so that's quite a time span there. The control group who didn't have the mindfulness training, 28 of the 60 had withdrawn from college, whereas only 9 of the 60 from the experimental group had withdrawn. So kind of interesting. I mean, there could be other factors there, but that's, I think, something to take note of. Again, with first year students and LGB, an increase in students' life satisfaction and decrease in depression and anxiety. With college freshmen and again, LTD, learning to breathe, healthy stress management and coping strategies, improvement in organization, time management, emotional awareness, and commitment to a healthy lifestyle and self-compassion. I thought this one was very interesting in the first year course with Indigenous students in Canada. They used a culturally responsive framework in doing the mindfulness training, and the students perceived a reduction in stress, increase in focus, attention, and general well-being. And they also saw a connection between things like the breathing exercises and some of their traditional practices, smudging and prayer. And so it was something that I think is to take note of, that's really important that we're considering all of those things, of course. And then for again, not a lot for at-risk students, but there were 2 pilot studies that I found that used mindfulness and acceptance interventions with at-risk students, and those results indicated decreased procrastination, increased behaviors such as seeking assistance when needed, and increased academic performance. Okay, and then this is just a reference page, so I won't go over that. And then my resources page. I won't go through all this, but if you want to look at it later, there's just general resources, there's guided meditation and activities, the mindfulness programs, developing or deepening your mindfulness practice, and teacher training and certification. One thing I am going to show is there's a lot of really good stuff online for the free guided meditation and activities. For example, the Koru has quite a bit of, starting with very short and working up to longer, and all sorts of different things, whether it's walking, guided imagery, labeling thoughts, eating, meditation, loving kindness, so a lot of stuff available there. And then also the same with this one has a lot of stuff available too, and also in Spanish. So going forward, I know that there is an interest among staff, professional student affairs staff and faculty. I think that it would be great if we can work together and collaborate on offering something. I have talked to other people as well that couldn't be here today about offering something next semester through our fitness center, but being referred through the counseling center so that we can kind of have it more formalized. a short workshop, or it's over a series of weeks. But one thing that that is important is that students commit to it rather than it be drop-in. You know, right now we offer drop-in, it's not being used. As we saw in the research, they need to be committing to that, and then having that guided practice, and then outside of training practice as well. So making sure that we're implementing all of those best practices. And then also in the future, I know that there are staff and faculty who themselves would like to start a group of just taking some time out and practicing together. So that might be something interesting. Were you guys, any of you, at the all-college duty days, would have been a couple of years ago, where we did have a person come in and talk about mindfulness?
I remember being there, but I wasn't able to attend that session.
Yes, well, I attended it, and I was amazed at how many faculty and student affairs staff came. It was packed. People were sitting on the floor, they were standing. Yeah, it was very well attended, and it just kind of shows, I think, that people are feeling kind of stressed, they are feeling kind of detached, maybe sometimes, or on autopilot, and you know, this kind of thing can make a difference in those things and just give you a little bit better awareness of and quality of life. So, okay, well, that is all. Thank you so much for coming to. Oh, any other questions? I'm sorry. Okay. Thank you, Jennifer. You can, I think, just hit the